Let's have a peek at those eyelids. Want you to look straight ahead. And can you close your eyes for me? And open those eyelids. Great. And close those eyelids. And open again. Okay. All right. Well, I certainly would feel you'd be a good candidate for the eyelid procedure, and I'd feel certainly very comfortable proceeding along. Now, I'm going to assume that you know a little bit about the eyelid procedure, or maybe you know a little bit about the standard way, but an important difference that is something that we always routinely talk about is the laser blepharoplasty. In other words, doing the eyelid lift with the laser as opposed to the standard scalpel. And there's an important difference between the standard way with the scalpel and doing it with the laser. You might have seen people in the past, perhaps, who have had it done in the standard way, in which they've got a lot of bruising and bleeding around the eyelids. They're kind of looking like raccoons afterwards. But with the laser, the idea of the laser is that we're using that laser as we move along to remove the tissue. And that laser actually cauterizes the blood vessels as we move around. And that means much less in the way of bruising and bleeding. And in addition, it gives me a much better view of what we're doing so that I can pay better attention to the aesthetics of what the eyelids should look like afterwards. So we strongly recommend, when we're doing the eyelid lift, to be doing it with the laser technique. Now, the procedure is not even done in a surgery center. It's done in our office operating room right here down the hallway there. And when you come in, we will need someone to drive you. We'll give you a little bit of Valium so that you can relax. And then as far as anesthesia, there is an injection on both sides. It's not in the eyes, not to worry, but it's just in the eyelid right on the outside portion here. So it's a momentary little owie with the injection, but it blocks everything in the whole area so that during the procedure you can't see anything that I'm doing, you can't feel anything that I'm doing, so you're perfectly comfortable during the procedure. Now, as far as the eyes themselves, because we have the laser around there, we're placing these shields in the eyes so that, again, you won't be able to see anything, but that also protects the eyes, because if there's one thing that's a priority around here, it's taking care of the eyes, which is why we do a lot of these blepharoplasty procedures. So the procedure itself, when it's done, will take probably about 30 minutes, 30 to 40 minutes. And when it's over with, you're able to go home and go home onto your own steam. I mean, you'll need someone to drive you. But the amount of swelling and bruising really should be minimal, as opposed to the standard scalpel way where the bruising lands up going perhaps to mid-forehead and mid-cheek. Well, there's going to be a little bit of swelling, but it's going to be limited to below the brow and above the lashes. Now, there is going to be a little suture on either side, and that's in there for 2 weeks. But because the bruising and swelling is so minimal, you're up and around by the next day. If you wanted to go to the grocery store or something like that, you didn't want anybody to know that you've had anything done, you just wear a pair of sunglasses and you're fine. As I said, that suture is in there for 2 weeks. You'll come back to the office in 2 weeks. It's a really easy thing to remove it, and it's a very comfortable procedure that just takes a minute or two. Now, some of the things that we like to emphasize to people is that we don't want to overdo it. I mean, our ultimate goal when we do this upper blepharoplasty is that we want to have that natural look. We don't want to overdo it, have that deer in a headlight look. We want to have just a natural look so that when somebody sees you afterwards, they would look at you and say, hey, you're looking well rested and looking pretty good these days. We don't want them to realize that you actually had something done as far as the eyelid is concerned. So we do want to be conservative as well. And the other factor in that is we are ophthalmologists, and the eyes are really a priority. And yes, there can be instances where plastic surgeons out there take care of the eyelids, sometimes with a scalpel, but not often with the laser. But I respect the plastic surgeons for everything that they do when it comes to tummy tucks and other plastic procedures. But when it comes to the eyes, we get pretty territorial there. And we want to protect those eyes. We want to remember those eyelids are the windshield wipers, essentially, to your eyes. And so we want to keep those eyes safe. So that's why we feel it's important to have us be taking care of these things and taking care of it with the laser. So overall, as I say, you'd make a great candidate, and we'd be happy to work with you. And if you feel it's something that's right for you, I'm going to take you up front and we'll continue that dialogue. Okay?
Okay, sounds
Good.
good.